All right, well, to talk about the potential implications of these Medicaid cuts, I'm joined now by Dr. Owais Durrani. He's an emergency medicine physician in Houston, Texas. Dr. Durrani, it's good to have you with us. You're the ER doctor that people see there in Houston when they go to the emergency room. Give us a good estimate. How many of your patients are on Medicaid?
Yeah, thanks for having me. A very large percentage of my patients are on Medicaid. In Texas, if Medicaid were to be cut in its current form, we would have an uninsured rate of 20%. And so what that means is, people come to the ER when they are having an emergency. If you lose insurance, you're going to come to the ER when you're having a worse emergency. So you're not going to be able to get primary care. You're not going to be able to stay on top of your chronic medical conditions. And you're going to show up to the ER in worse decompensated conditions. And we know from a lot of data, and then myself from personal experience, that those patients have worse outcomes, including death. And we know that if this bill passes in its current form, we will have an additional 55,000 deaths yearly. And that is just unconscionable. And it's hard to even say those words.
So the emergency rooms in the United States, they should be bracing for what, if I understand you correctly, is a tidal wave of more patients, correct?
Absolutely, yeah. So we are the front door of the healthcare system in the United States. And so when patients have nowhere to turn to, they show up there. We currently have overcrowding just as it is. We have a 13% uninsured rate across the United States. And so we should be trying to expand health insurance, not decrease it. The other thing that Medicaid pays for is nursing home care. And so a lot of times when we get patients in the hospitals, we'll stabilize them, treat their infection or whatever they're there for, and try to get them discharged back to a nursing home or a skilled nursing facility. Well, Medicaid pays for that. And so when you lose funding for that, 1 in 4 nursing homes are projected to close. And so we're not going to be able to get those patients discharged from the hospital. So not only are we going to have a rush coming into the hospital, the patients in the hospitals won't be able to leave, and it's just going to worsen the problem.
Well, help us understand this then. If people lose their Medicaid coverage and they come to the emergency room in an emergency, who absorbs the cost then if they can't pay the bill?
Yeah, so when you show up in an emergency, we're going to take care of you. And so they're going to be taken care of. Unfortunately, they're going to be in a worse off condition, probably going to have worse outcomes. But then what happens is the hospital has to get paid, right? And so they're going to negotiate higher rates with private insurance companies, those rates, and then they're going to pass that on to their insured population. And so even if you're not on Medicaid, your insurance bill is going to go up. Someone's going to pay for it, and it's going to be the American public. And so a lot of times it's framed as, hey, I'm not on Medicaid. It's not going to impact me. It's not going to affect me. It will affect every single person in the United States if these programs are cut.
And for our viewers, too, who may not be familiar with Medicaid and nursing homes, I mean, you're right. A lot of people do go to nursing homes in the United States. It's paid for by Medicaid, but that comes with a big provision, and that is they have to spend down all of the assets that they have until almost nothing. So if you're forcing people to spend themselves poor before you get Medicaid, what does this mean then if Medicaid's not even an option?
Yeah, it's unfortunately going to mean an increase in uninsured rate here in Texas. As I kind of mentioned, we're going to have a 20% uninsured rate, which is terrible. We already are amongst the worst when it comes to various health outcomes. Those will get worse. People will delay care. They'll show up to emergency departments sicker. And the other part that I'd like to point to is that rural hospitals will close. So for a lot of folks, rural hospitals are lifelines. And if those close, they may be 2, 3, 4 hours away from the closest hospital, which means if you're having a heart attack or a stroke, you're not going to get the care you need in time to prevent the worst outcomes of those diseases.
Yeah, that's a very good point to make. The country hospitals, they seem to be dying out as well. Dr. Durrani joining us from Houston, Texas. Dr. Durrani, we appreciate you taking the time to talk with us. We know you must be a busy man. Thank you.
Thanks for having me.
Thailand's Prime Minister